In this video, we'll discuss drug formularies and look at the unintended consequences that can occur when plans restrict or change patients' access to medications. The formulary is a list of drugs approved by a health plan, typically arranged into tiers. When designing formularies, insurers and pharmacy benefit managers, also known as PBMs, should consider clinical data on a drug's medical benefits alongside its cost. But the truth is, drug cost is often what drives formulary decisions, and pharmacy benefit managers typically negotiate cashback rebates from drug manufacturers in exchange for preferred spots on a formulary. Tier 4 is where it hits home for anyone with a chronic condition or serious illness like cancer. These are specialty drugs and are typically the most expensive for the PBM. Chemotherapeutics are often specialty drugs. Health plans typically require a hefty copay or coinsurance rate for these drugs, if they are even included on the formulary that patients can access. Pharmacy benefit managers and insurers can change a drug's tier or completely drop a drug from a formulary at any time during the year for any reason. When patients face a change in treatment for any reason that isn't about improving care, it's called non-medical switching. In the following story, you'll learn how the unintended consequences of non-medical switching driven by formulary changes can affect a patient.
In April of 2014, I was out of the blue diagnosed with colorectal cancer. Unfortunately, I was left with an extraordinarily difficult side effect as a result of my treatment. I experienced some really serious chronic bowel issues that made quality of life extremely difficult for me. I also had a wonderful surgeon who prescribed a medication. It was life-changing for me. And then suddenly I and my primary care physician and my surgeon were notified that this medication was no longer on formulary. We filed appeals. We did everything that we could to no avail. Here is 75 days worth of my prior medication. This is 30 days of the new medication. 6 packets a day, each packet having to be mixed with water or fruit juice. Unfortunately, I did know that a formulary could change at any time, but of course, it became very real for me as an individual. While my medication is not going to save my life, it gave me back my quality of life. And yet every single day, individuals are facing these circumstances for medication that is life-saving or life-changing.
So keep in mind that formulary changes and exclusions can have unintended and often serious consequences for patients. There are a few things that employers can do. You can require your plan to offer an open formulary that covers prescriptions for all FDA-approved drugs and biologics when appropriate and medically necessary, including off-label use when supported by evidence and expert consensus. You can prohibit your plan from changing the formulary mid-year. You can minimize out-of-pocket costs for drugs used to treat chronic conditions, to increase medication adherence and improve patient well-being. To learn more about how utilization management can affect patients, please refer to the booklet Best Practices for Prescription Drug Benefit Design, available at cancercare.org, and view the other videos in this series.